Hello, my name is Abdalla Zarroug. I'm a pediatric surgeon at the Mayo Clinic in Rochester, Minnesota. That's a division within the realm of general surgery, but we are our own section of pediatric surgery here. Pediatric surgeons really deal with the growth and development of children just like pediatricians do, except we operate on them. We're really physicians or pediatricians that operate, and that's the best way to think about us. We have special training in general surgery, and we go through general surgery, but on top of that, there's an extra period of training for at least 2 years within its own specialty that we specialize in children. 100% of our practice are children. That means from the fetus essentially all the way up until 18 years old. Minimally invasive surgery really is surgery that we perform the same as an open technique, however we make smaller incisions. That's really the only difference between the two. However, there are some benefits associated with that. Well, what's minimally invasive surgery? Well, some people call it minimal access surgery, keyhole surgery, laparoscopic surgery, which means minimally invasive surgery of the abdomen, thoracoscopic surgery, which means minimally invasive surgery of the chest. So traditionally, through an open approach, the average stay is anywhere from 5 to 7 days. They recover well, but they do stay in the hospital. They have an incision to recover from, and they have a little bit of pain that they need to recover from as well. However, when we do this laparoscopically or through minimally invasive techniques, the procedure on the inside is the same. However, on average, they stay just 1 or 2 days. Oftentimes, the next day they start a diet, and they're on a post-Nissen diet or a post-fundoplication diet. And if we do this on a Monday, the patient goes home on a Tuesday. That's not uncommon. It is almost always certain that if there's no complications, they'll go home within 48 hours. So let's talk a little bit about an example of where we have modified a traditional open approach for a procedure into a minimally invasive technique with success. So let's take gastroesophageal reflux disease. It's not just an adult disease. There are many children with this disease for various reasons. Some of them are born with neurologic diseases that predispose them to gastroesophageal reflux disease, and some just develop the disease because it happens in an American population. So traditionally, the workup is exactly the same for an open approach or for a minimally invasive approach. The indications are the same, you see the same physicians, and once you come to the decision that someone needs a fundoplication, which is a wrap of the stomach around the esophagus, and that is the surgical procedure that corrects gastroesophageal reflux disease, that's when you have the option to get an open approach, which is an incision on the belly. It could be up and down, it could be sideways, but it's about the size of a child's fist is what the average incision is. Or you can have minimally invasive surgery where we use 3mm trocars, about 4 of them, 1 in the belly button so you never see that scar, and 3 other small dots are what they end up looking like, where we do the exact same operation on the inside and we end up with the same outcomes, in my opinion. So, do we really get different results? Well, we clearly get different incisions. And it's really a choice of the patient. I don't tell them that one is necessarily better than the other because the medical result is the same. It's the end of the reflux. That's the goal. And the results long term are the same as well. The complication rates are similar as well. The difference is really that you have an incision that's a lot smaller. Instead of being the size of a child's fist, which may be 5 or 6 centimeters, you have 3 little incisions that you grow up with that are 3 millimeters apiece, and they hide really well within the skin incisions, within the skin folds. What a pediatric surgeon does is operate on the neck, chest, abdomen, and pelvis. Now here at the Mayo Clinic in Rochester, we also have other specialties, and that includes pediatric neurosurgery, pediatric ear, nose, and throat surgeons, pediatric orthopedists. And the real benefit being here at the Mayo Clinic is that we can mobilize all of these specialties within the realm of surgery and the pediatric specialties so that the child can get worked up almost within 24 to 48 hours. We can get CAT scans, we can get MRIs, we can get other imaging studies, all within one visit, so that we can give the parents the very best opinion that we can.